Hello, welcome. My name is Amadou Kone. I'm today looking at a gastrointestinal disorder study points. These study points are what you're going to find in almost all of the question banks around the U.S. when it comes to Nclex studies. Today we'll look at the GI disorder and other important points for this system. Um, the GI has a couple of functions. It functions in food, how we process food, how food can be absorbed through digestion, how we can excrete unabsorbed waste product from the body, and it also provides an environment for microsynthesis or it synthesizes nutrients such as vitamin K. So vitamin K and other nutrients are synthesized within the GI system. And it also has other distinct functions that we'll talk about. Now, the system has parts. It starts from the mouth, the esophagus, the stomach, the small intestine, the large intestine. You have the liver, the gallbladder, the pancreas, the rectum, and the anus. These are just the main points of the GI system. Now, the stomach has a couple of things that you want to make sure you follow them and know what they are. Like it contains the cardia, the fundus, the body, and the pylorus. There is a mucous membrane. The mucous glands are in the mucosa and they prevent autodigestion by providing an alkaline environment. It also you have the lower esophageal sphincter muscles or the sphincter area, which helps to prevent gastric reflux. That is, when you eat food, the food you eat, this sphincter or this valve helps to prevent the backflow or what we call the regurgitation of food back into the mouth. Then you have at the lower end, you have the pyloric sphincter, which also help to prevent food from coming back into the stomach. Then you have the hydrochloric acid, which is also a gastric juice that kills bacteria or microbes that cannot be saved within the environment within the GI tract. It helps to break down food into smaller particles and provides a chemical environment that facilitates gastric enzyme activation. You have another enzyme or gastric juice called the pepsin. Pepsin serves as the chief coenzyme of gastric juice. It converts proteins into proteases and peptones to break down other things in the body. And then you have a couple of items that come from the parietal cells that are necessary for vitamin B12 absorption. Then you have the stomach also controls the acidic level of the GI. So the intrinsic factor comes from the parietal cells and they are necessary for vitamin B12 absorption. Then you have some other gastric juices like the gastrin that controls the gastric acidity. All of these are important points for the stomach and for the entire GI system at large. Then another important thing is GI diagnostic procedures. Now, these procedures, they are very important when it comes to the Nclex. We have to understand them one at a time. The barium swallow. The barium swallow is one of those common procedures you would do in GI clinics. So in the GI clinic, you do barium swallow. So for the barium swallow, it is a test in which the patient drinks barium sulfate, wherein they have to go to the hospital or to the clinic fasting for at least 8 hours. They go into the clinic, they're going to drink barium sulfate, and then it is monitored through the fluoroscopy until the procedure is done. Now, we have to hold full, like I said, for 8 hours, and after the procedure, you got to drink laxative that helps to clear out the bowel. It has a couple of other things that you have to monitor for, and that when you have it, and then for the first 72 hours after the barium swallow, the stool will look chalky. It will look that kind of a whitish or chalky white color of the stool due to the barium that was ingested a couple of days ago. So you got to make sure to monitor for the barium because if it stays within the GI tract, it causes GI obstruction. So it is important that when you do barium swallow, we should monitor until it is excreted from the system. That's why we take medication to like move our bowels in as much as possible. Then we have what we call the capsule endoscopy. Now it's called capsule endoscopy. It is like they have a small camera in the form of a capsule that you swallow. It goes into the GI tract and it goes down in the GI tract. It is meant to detect GI bleeding or changes in the lining of the small intestine. That's the function of the um, capsule endoscopy. So what happened in the capsule endoscopy is the patient have to remain on clear liquid diet a couple of hours before the procedure. Then they can be on NPO for like 3 hours before the procedure. They will go into the clinic or into the hospital or into the doctor office, wherever the procedure is being done. They will give them this little capsule that looks like a capsule. It is a chimera. They're going to swallow it. Then they will leave the doctor office for a couple of hours. So they're going to go home or go wherever they want to go for the whole day and come back at the end of the day. Then they will have a belt that contains like a little box. The box will serve as as the medium in which the camera takes picture along the GI tract. Those pictures or photos are transferred into the small box. At the end of the day, the small box serves as the record storage area wherein they're going to come in and remove all the pictures and see the line of the GI tract to see what there's bleeding, if there's any GI abnormality. Now, then you have gastric analysis, you have the fiber optic colonoscopy, you have laparoscopy, you have the MRI or the magnetic resonance cholangiopancreatography, you have the computed tomography or the CT scan of the GI tract, you have paracentesis, you have liver biopsy, you have stool specimen collection, you have the urea breath test for ulcer condition of the GI tract, and you have the esophageal gastroduodenoscopy. Now, all of these tests are important that we make sure we understand them for the Nclex. We know exactly what we are looking for in the Nclex. Then you have the main GI disorders. Now, these disorders are 90% what you're going to find in the Nclex when it comes to the GI disorder. You have the gastroesophageal reflux disease, GERD. You have gastritis. You have the peptic ulcer disease. You have dumping syndrome, which falls under one of these conditions like bariatric surgery. You have vitamin deficiencies. You have bariatric surgery itself. You have the gastric cancers. There are different kinds of gastric cancer. Like you have gastric liver cancer or liver cirrhosis. It falls under GI disorder. You have GI hernias, like you have the hiatal hernias, umbilical hernias. Those different GI hernias all fall under the GI disorders. You have celiac disease, you have the gallstones, you have gastroparesis, you have cholecystitis and cholelithiasis, you have liver cirrhosis, you have esophageal varices, you have hepatitis. Now, it is a big continuum of different diseases of the same category. You have hepatitis A, B, C, D, and E. Then you have pancreatitis, you have ulcerative colitis, you have Crohn's disease. We have diverticulosis, diverticulitis, we have hemorrhoid conditions, you have IBS, the irritable bowel syndrome or bowel diseases, you have lactose intolerance. Now, these diseases, these different bowel disease or these different GI conditions, they are very important for the Nclex. We have to make sure we look at them, we know them very well. Then we have other risk factors that are linked with the GI disorders. You have like an allergic reaction to food medications. You have cardiac, respiratory, and endocrine disorders that may lead to slow GI movement or constipation. You talk about chronic alcohol use. You have chronic stress level. You have all these things are important, tobacco use and other things. Now we have to make sure and know these things for the Nclex before our Nclex on the GI system. We talk about acute versus chronic gastritis. We talk about gastric and duodenal ulcer, all both fall under the peptic ulcer disease conditions. You talk about all these things. Now, it is important for us to make sure and look at these conditions and know what they are. Because in the Nclex, If we read these different diseases under the GI, we've completed our Nclex study 100%. Thank you very much. Look at them. Bye-bye.